Today, we're talking about compassion fatigue in healthcare.
Compassion fatigue is often defined as kind of the emotional, physical, and psychological kind of burden of caring for others, of witnessing illness and trauma and death over time. So this isn't just like a fuzzy feeling that gets lost. This actually has real implications for doctors. Well, don't get too connected to your patients.
Mm-hmm.
Don't ask them, don't know too much about their personal stories, because we know that eventually you're going to be walking them through the end of life and it can be more painful, right? Sometimes it gets to the point where you say to yourself, how is this sustainable? Right?
Yes.
How can I keep doing this?
I almost feel like we should put it on our fridge, and how I give my daughter sticker charts. I could do that. That should totally work. I love that.
So I think to pretend that we are superhuman, that we are robots, that this isn't going to affect us, I think it's a disservice to our field.
I totally understand you that we got to humanize the patient. We got to hear their stories. But how do you preserve yourself? Because it's hard.
But when a person dies unexpectedly, it is a normal and natural response for your first thought as a physician to say, what could I have done differently? Right? Doctors who are sleep deprived, it's an independent risk factor for anxiety, depression, and suicide. There is a lot of shame surrounding, and I should just be able to be superhuman. I should have an unlimited amount of emotional and physical energy. So I specifically know women who were told in their training that they would be a waste of a role, or a waste of a medical school slot if they decided to work anything less than full-time. First of all, quit your job. Don't ever quit your life.
Before you know what kindness really is, you must lose things.